Good afternoon, everybody. Welcome to the weekly Facebook Live here for the St. Clair County COVID response. I'm Justin Westmiller, the Director for Homeland Security and Emergency Management here in the county. And as always, we have
Annette Mercatante, St. Clair County Health Department.
All right, so let's get right to the data. To date, 8,647 total cases, 505 hospitalized with 246 deaths. And we've got currently 6,963 people recovered. In the last 7 days, we've had 137 new cases, and we're averaging just below 20 a day, while averaging 264 tests per day at a 4.2% positive on those tests. So that's rising just a bit. We're going to keep an eye on that. So here you can see the trending for the cases. We kind of hit a valley and there's a little uptick. And so we're keeping our eyes on that. And we'll just remind everybody to do everything you can to help us slow the spread. And then this is the testing percent positive. We're kind of right in line with that. We went up a couple of tenths, but we're holding fairly steady. And then to date, we've administered through the county 23,400 and some change, 438. And we've received 28,500 into the county. And as always, the dashboard link you can find anytime with up-to-date information at stclaircounty.org/offices/health/COVID-19 ASPX.
Okay. Jen wanted us to go first to our talking points before we started taking your questions, because there's a lot of important things to share with you. So I'll start, and Justin, then you do yours afterwards. We want to make sure you know about some of our partnerships, our community partnerships. As we get vaccine, we want people to have as many options as possible to get vaccinated. And most recently, we've shared some vaccine with our Kroger stores. This is both the north and south end Krogers, as well as the one in Algonac. People, and they are vaccinating the people 65 and older, and they're using our registration list. So if you've registered on our website at St. Clair County Health Department, that is the registry list that they are working off of. So you may be receiving a call from the Kroger pharmacy on behalf of the St. Clair County Health Department to schedule your appointment. And that we thank them very much for them offering to help us with this. They will identify themselves, and the caller ID should say Kroger's with a 586 area code. This is a legitimate call, but remember, there should be no personal questions about your social security number. They shouldn't be asking you about a bank account or need a credit card information. They should be just be calling you to schedule you for this vaccine appointment. So please do not show up. Please do not show up to your local Kroger pharmacy for a COVID-19 vaccine without an appointment. We are only providing them a finite amount of vaccines, and they are using them based on their scheduling process. So they won't have one to give you. So don't frustrate yourself and other people. Additional pharmacy partnerships right now are through Meijer's and also Hamzavi Dermatology in Fort Gratiot. They have also received some vaccine from us and are utilizing their own list. So those pharmacies will be using schedules and lists that they have from there, also 65 and older. And so, as you mentioned, as you might know, Rite Aid Pharmacy is receiving vaccine. That is a separate entity from us. They are receiving their own vaccine from, I don't know, federal government or the state, and they are also utilizing their own process. McLaren Hospital is receiving their own vaccine directly from the federal or the state government, and they are utilizing their own registration system to vaccinate. So those are other places that you can seek vaccines out. So today, I also want to mention from 4 to 5, there's a town hall with minority communities that is hosted by the state of Michigan to talk about vaccines in the minority community. And it will appear on the MDHHS Facebook page, and you can watch it live or later. That should be very helpful and interesting as well. Justin.
So a couple things I have. If you no longer need an appointment, just make sure that you either you go into your account on Everbridge and basically notify us that you don't need you don't need vaccine. And that's basically option 3. If you do get a phone call from the system, make sure you select option 3, that you no longer need the vaccine. We just want to make sure everybody's welcome to pre-register, and we're asking everybody to register on as many lists as possible. And then if you already have received your vaccine, make sure you let us know and decline it. As far as COVID-19 testing, we are conducting testing daily at the Marysville testing site. Make sure you go on the health department's website and click testing, not vaccine. It's a totally different list, and we'll get you tested. It's very important and critical right now that we continue to get high numbers of tests in, so that we can help control any spread and make sure we know where all the cases are.
All right.
Okay.
Thank you very much. All right, let's get started with the questions. I'll take a few that we had from last night before we get to the live page. Okay, Dr. Mercatante, why don't the nurses wear gloves when administering the vaccine at the vaccination clinics?
Okay, well, gloves are intended to be used to protect the healthcare worker themselves. Okay, the gloves are not used to protect you; they're used to protect the nurse or whatever healthcare worker is doing that procedure. Against bodily fluids or potential infection agents, which there are none in a vaccination process, right? So they're not being exposed to any infectious agents. They could wear gloves if they want, but most of our nurses feel they have, I think, better control of the syringe, et cetera, without it. So it's basically not needed to protect our nurses, and they choose not to wear them.
Okay. Justin, is there a way to report to whatever governing body there is in charge that the number of doses that St. Clair County is receiving is only able to vaccinate a tiny percentage of the population that is currently trying to get vaccinated? Seniors are having to travel to other counties in order to get vaccinated. Surely St. Clair County deserves as many doses as other counties.
Well, so I'll answer that 2 ways. One, every county absolutely deserves as much vaccine as we have community members. But right now, because it's such a scarce commodity, the state of Michigan per week right now is only seeing about 150,000 doses for the entire state. So what they're doing is they're just basically allotting that 60-40 to the health departments and 40% to other partners that Doc already talked about. And until we get a much larger input to the state, higher than 150,000 a week, we're gonna consistently struggle a little bit to meet the demands of the community. That does not mean that we don't want to meet the demands of the community. It just means there isn't vaccine available. In the next 2 months, we know that there's potentially 3 more vaccines that are going to come online, and that will add millions of doses into the repertoire. So until we get there, it's going to be a little bit of a struggle, and we're just doing everything we can to make it through at this point.
Yeah, and I don't really know that we're proportionally by a population getting any less than what a community that has a much higher, so Macomb County may be getting several thousand doses of vaccine a week, but they also have,
600,000 people.
There you go. Yeah. So proportionally, I think our vaccine distribution, and I can tell you for other communities our size, other counties our size, this is about what they're getting, about what we're getting. So
right.
I don't know if it's that.
Yeah, and just to let everybody know, there are no inequities when it comes to how the state is they're literally following that 60-40 and providing it just on population and some other factors that they're considering as well.
Now, what some communities do have are healthcare systems that are running large community-based clinics that are using their hospital-based vaccine in a different way than ours is. So that may be making the appearance that there's more vaccine available. And as you know, we continue to work with our community partners to advocate for that as much as we can.
All right, next question. And there's also one similar to this on the live feed as well. But when will those under 65 years old with underlying health conditions be eligible for the vaccine in St. Clair County? And then someone else asked, when are we getting to the high-risk groups?
Well, we are doing the high-risk group. The highest risk group is elderly people. The older you are, the higher your risk for having a severe bout with COVID. Okay, so we are doing the high risk groups. The issue of under 65 with other medical conditions, it really depends on how well the state moves through the 65 and older. There are areas of the state that are doing better than others. We would anticipate doing much better in the next few weeks. I think we're going to see that we're going to make a dent in those who are waiting for the vaccine. That doesn't mean that we've vaccinated as much as we want, but I think we're going to see a dent. The state is predicting May to open that up, and I would suggest that we'll probably see it a little sooner than that.
Okay. Justin, is there a way to check to see where a person is in line to receive an appointment on the pre-registration system?
Right now, individual users are not able to go back and find out where they fall in line because there's a lot of different factors. One, which priority group are you in? When did you sign up? And how much vaccine we're given every week. So you don't have the ability to go back and look in your account and find out where you line up. But I assure you, we are following that as closely as possible. And it gives us a daily timestamp so we know who signed up when.
Okay, so that's another question. If we edit our profiles, do we keep our original registration time and date?
So we believe they worked that through, and if we find that you've been moved for some reason, we have the ability to go back and put you back to where you were before. So at least we've gained that capability to ensure that people don't lose their spot in line.
Okay, thank you. Dr. Mercatante, who orders the number of doses for you to distribute, for us to distribute? St. Clair County is almost last on the list with regards to number of doses received.
Number one, we're not last on the list. Please don't put yourself in that kind of underdog mentality. We are, as I mentioned before, we are receiving the doses pretty comparable to other counties our size. And there are smaller counties that are getting a lot less than us. So I wouldn't go there. We don't order vaccines. We are told how much vaccine we're going to get based on the allocation formulas that the state comes up with. So we are provided first dose allocations, and then the second doses come automatically based on what first doses they have given us. So another reason why it's important for us to just kind of keep moving through. So the current allocations that we are anticipating for the next several weeks are around 1,000 doses. We're hoping for more. And I also noticed someone wants to know what vaccines are we getting, Pfizer, Moderna. We have asked for both, but we are mostly getting Moderna, but we will take whatever they are willing to give us. Okay, especially if it means they'll give us more.
Okay.
Can
Justin.
I add to that? Can I add to that?
Yeah, go ahead. Yep,
So,
go ahead.
And just so people understand, this week in the entire state of Michigan, roughly around 90,000 Pfizer doses were available and 59,000 or so Moderna doses. So that's where we came up with the 149,000. That's statewide. So as you can see, it's still a pretty scarce resource for the 7+ million people that live in the state of Michigan.
Thank you. Justin, what is a good link for people to go to for the current COVID-19 restrictions that MDHHS has ordered? Yeah.
So go on the MDHHS website, and right in the middle of their front page says coronavirus. It's a big window that you just click on, and then you can tab through there and find the information you're looking for. It's very easy to find.
I always just Google MDHHS epidemic orders, and it takes you right to a list of the most recent ones. So you can do that as well. Just ask for the current epidemic orders.
And we also have a link to that on our health department
and yes,
COVID
it's confusing.
page. Yes.
It is confusing.
It's confusing. I have people now that I've said, this is your job to keep track of how many people are allowed where. So yeah. I don't blame you for needing to look.
There's a couple of us that try to keep Doc straight on that stuff. So
we appreciate it.
Yeah. Someone needs to do it.
Can you provide an update on any of the variants detected in our community?
Yeah, thank you for that question. As far as we know right now, there still is just the one. And that contact tracing did not result in any secondary infections yet, I don't believe. I think there are still people that are being monitored. That individual is doing well, has not been hospitalized, is compliant. As you know, we mentioned he has not traveled, which would suggest that this variant is circulating here as well as all other places in the state of Michigan and throughout the country. Probably not widespread at this time, but we'd like to keep it from getting as widespread as possible for as long as possible.
Okay.
And right, that goes
ahead.
right back to testing. So it's important, if you're not feeling well for any reason, go and find a test. And if you need help with those tests, we have a testing site in Marysville. You just have to sign up for it.
Yeah, and our tests, if you're positive, a sample will always go to the state lab for genetic sequencing, every single one. So we are watching as much as we can.
Okay. Would you consider it safe for individuals who have received both of their doses of the COVID vaccine to get together indoors with others outside of their household that have also had both vaccines or doses? For example, getting together with friends for dinner at their house.
I hesitate with the word safe, and you guys know that. That's a tricky word. What do you mean by safe? The risk is lower in the scenario that you just described, and is much lower than it would be if neither party were vaccinated, or if either party was frequently going out and going around in crowds. There's also, what does each individual party do while they're not together like that? But it would be less risky in those situations. Remember, the vaccine is not 100% effective. We don't consider the full effect, the full vaccine effectiveness to occur for 2 weeks after the second dose. So make sure you're fully vaccinated and you've gotten past that time frame. And of course, any illness or known exposure, you should still practice extreme caution and not expose yourself to other people, even with the vaccine.
Along those lines too, someone had asked that this person has received both of their doses of the vaccine, and they want to know, when can they safely hug their unvaccinated adult children and their 14 and 15-year-old grandchildren?
So define safe.
Yeah.
God forbid, I do not want to tell you not to hug your grandkids. And now that you're fully vaccinated, good for you. If you're feeling well and your children are not showing symptoms and have not recently been exposed to a known COVID case, hug away. Hug away. Wash your hands good. If you're really worried, wear your mask. But there's a risk involved to everything, but I would say now that you're vaccinated, that risk is less, and you just want to, pay attention to what you're doing.
All right. So now we're on to the questions that are coming in today on the live feed. This person wonders if St. Clair County will follow Macomb County in opening up vaccines for 60 plus years of age.
Did they do that? So throughout the state, there is a special program that is allowing us to vaccinate 60 and older for communities that have very high social vulnerability indexes. These are our minority and our communities that have difficulty with transportation. We are planning on doing that, but those are for special communities where there are special needs. Until told otherwise, the standard eligibility is still 65 and older for our broad community-based clinics.
All right. The next person asks, can you speak on COVID in terms related to influenza? In comparison to the COVID vaccinations, what is the efficacy on yearly influenza vaccinations?
Okay, so influenza vaccines are felt to be, it's been a while since I've been talking about influenza vaccines, about anywhere from a 40 to 60% efficacy. I think it depends on the year. It depends on the age group that you're reviewing. And so we have never really had an influenza vaccine that was proposed to be 90% plus effective the way these mRNA vaccines are being supported. So I would say overall, the influenza vaccines were not as highly effective, but they were helpful in reducing transmission and certainly helpful in preventing serious outcomes from the flu. The I'm trying to understand kind of the gist of this question. Comparing COVID and flu is like trying to compare polio and, I don't know, something else. They're two different diseases. They're just two different conditions. And it's kind of hard to describe one compared to the other than obviously influenza was the source of our last big pandemic in 1918. That's not what we have now. We don't have an influenza pandemic. We have a coronavirus pandemic. So it's like comparing apples and oranges. So I'm not really sure what you're trying to get at. I apologize. Maybe you can ask it again.
Okay. The next question is, what percentage of 65 plus in St. Clair County have received their vaccination?
27%. Woohoo! We're getting there. We should be doing a little better than that. I'll be honest with you, for transparency, we're a little below the state average. And we're going to work really hard to catch that up. In my opinion, that's because at the beginning, when we were getting little bits and pieces and little spits of vaccine, we really focused a lot. We made some commitment to do our teachers, and we made a commitment to do some of our, first line people. And I think we got a little behind in that regard, but we'll catch up. I think the state average is 36%. So I think we can catch up pretty quickly.
And speaking of 65 and plus, and someone else asked, how many 65 plus are there? Do we have in Clair County?
30,000 or so.
And this,
so, even the people that are waiting for a vaccine is just a small fraction of the total amount. So I'm hoping the rest of those people that aren't signed up with us are finding their vaccines elsewhere. I don't know at this time what the percentage of 65 and older are willing to get vaccinated at this point. I hope it's upward of 60%, but we'll see.
Okay. Next person asked, how many vaccines were received this week? Did we receive this week?
This week, meaning the week that we're currently vaccinating in?
Right.
And that's a little tricky because we also received the vaccine that was not delivered on our snow week. Who's got that number? Total countywide 3,900. Countywide 3,900. Is that all first dose or? For both first and second dose. Both first and second dose. 2,300 went to the health department. 1,600 went to the hospital. Okay, so 2,300 went to us and 1,600 went to the hospital.
Yeah, so about 1,150 per week because we got 2 weeks worth.
That's about right. About 1,000 a week, and I'm hoping to see that pushed up, if we're lucky, by another 1,000. But I'm not holding my breath for that.
All right. The next question is there anything new about how beneficial the first vaccination is on a recovered COVID person?
No. I have not seen that data. I know that in the clinical trials, the vaccine was provided to individuals with both a history of COVID and those without a history of COVID. And it was found to be safe and effective in both, meaning in both of those categories, people did not get severe illness after the vaccine. So remember, in the clinical trials, people were not swabbed to see if they had any infection at all. They were screened regularly to see if they got severely infected, if they became symptomatic, or, and whether or not they got severely symptomatic. So that's the part where we still don't know whether these vaccines will prevent any infection or if it's just preventing severe infection. And we're hoping the former, and we're hoping to get some evidence for that soon. But as of now, we can't be sure of that because it wasn't tested for. It wasn't studied.
Okay. The next person asked, do we need to get the vaccine in the county we live, or can we go elsewhere?
Oh, you go ahead. You haven't had
I'll
a
take that
chance,
one.
Justin.
So no, you don't. You aren't required to get it in the county you're in. What we're telling people is get it anywhere you can, but just know that wherever you get it, you'll have to go back for your second dose. So just be prepared if you go out of county and any far distance away, you'll have to return there to get your second dose.
Do you want to talk, though, about how we try to emphasize if you live or work in St. Clair County?
Yeah.
A lot of health departments are doing that.
Yeah. So, and Macomb County is doing the same thing. I know that because a lot of our workforce goes to Macomb and Wayne. So if you live or work in that county, you're absolutely eligible. And then many other counties are doing it on a case-by-case basis, depending on when you sign up. So as long as you work or live in St. Clair County, you are welcome to sign up and get on the list to get vaccine.
Okay. Next question. What registration date are you vaccinating today?
Yeah, so it doesn't really work like that. We don't pick a date off of the spreadsheet that it provides. It will automatically, we'll tell it we have 900 doses to do, and it will automatically call a certain block of people starting from the bottom or when you first signed up, and it gives you a 1 hour time frame to accept.
No, we changed that.
Okay, we did. What's the new time frame?
I think are we using 4 hours now, Jen?
Okay.
I'm not aware.
It depends on the clinic, but I do know that we've changed that. We've made that time frame a little longer. Is it 4 hours now? It depends on the clinic. So if it's a clinic for the next day, we're going to use a shorter time turnaround. But if we're sending out appointments for a clinic the following week, we're going to give you, in fact, I think over the weekend we gave 48 hours. We did open that up a little bit.
Yeah, and that's what happens when you miss one phone call
Yeah,
with the health department.
and I just want to say that as much as I'd love to say that this system automatically calls, it's not quite working that well. And what we are having to do is take those names on our list and send those appointments out. And so that does give us a chance. I believe the last time we looked, I think that what the question wants to get to is how quickly are we working through our list? And I think the last time we looked, we weren't all the way through Friday, but remember Friday, the very first day we opened up was the vast majority of when people signed up, those first 48 hours. So after we get through those first 2 days, we're not going to be looking at thousands and thousands of people each day. So, and I believe we heard we were at least halfway through, if I'm not mistaken. So, and that was last week that I got that information. So I do think we're moving through these lists at a decent pace now. It's not like we're not doing anything. Not fast enough, I know, but I think we're getting there.
All right. Do we know how long the vaccine will last, or if a booster will be needed yet?
That's a common question. And so far, the clinical trials that started with Pfizer, which is the first one, are about 9 months out. And the good news is the immune response is still pretty robust 9 months out. So we are all hoping that the vaccine immunity is going to last a year or more. All right. That's pretty standard for most vaccines. There's no reason to think that the vaccine, the immunity is going to waver or wane more so with this vaccine than others. The concern, of course, is the variants and whether or not the genetic drift and the genetic changes of this virus will make the vaccines a little less effective. That may be a reason to booster. Some of the newer other vaccines that are coming out, I don't have as much data to tell you about those. So it's possible some of the other vaccines coming out may need more frequent boosters. The simple answer is we don't know, but we are confident that you're going to see at least 6 to 9 months of immunity, and I'm pretty sure you're going to see more than that with the 2 current vaccines that we're using.
Okay. The next question, if one has a compromised immune system, is there a way to find out how effective the vaccine is after the second dose was given? If so, where would one go for that test?
No, unfortunately, the simple answer is no. We don't have a post-vaccine blood test to tell whether or not the antibodies are there. Now, you can check your antibodies. We just don't know what they mean. And so I would not get too reassured by that. You can go to your doctor's office and ask for an antibody test, but we really just don't know yet. It's possible that with an immune compromised condition, you may not have as good of a response, but remember, this vaccine also stimulates something called cellular immunity, which cannot be measured by a blood test. And what that means is that when your body is exposed to the wild virus, your cellular immunity kicks in as a memory, like a memory army that can come back and fight the virus. And that can be there even with no detectable antibodies in your system. So there could be still very robust immunity with a negative blood test. So it's a little bit of an uncertainty. You're going to have faith, hopefully, that you received some benefit. And we do believe you will likely receive some benefit from the vaccine, regardless of your medical condition.
All right. This next person said that they never got called back. They were called and they could not go. They were told they would not lose their place in line, but they did not get a call back. So they went to Meijer, or they went and they signed up through Meijer, and they go tomorrow.
Okay,
Yeah,
good.
so that's easy, right? One, we're asked, like we just said a minute ago, go everywhere you can and sign up. And if you get an opportunity, take it. But as far as never got a call back after you were unavailable for that clinic, we have spent all of the appointment times for this week basically already, which is why you haven't gotten a call back. We haven't done the run for next week yet. So that's likely why you haven't gotten a call back yet.
And like you said earlier, Justin, too, just about if they do get a call from us, to make sure that they don't confirm the appointment, that they decline it.
Absolutely.
If they get a call.
And I'm just going to be the one to say,
or to
I'm sorry.
cancel it, I should say.
I'm sorry the system isn't perfect and is working like clockwork. It's working better than it was. But we apologize for the inconveniences and the struggles that you guys are having. If you really don't know what to do, use our COVID-19 email, and we'll get back to you and try and work out things for those of you who are falling through the cracks and, are confused. But I'm glad that you found a solution that worked for you.
The next person asked, when you speak of antibody tests, is that what's done during blood donation?
Yeah. Now blood donations look for a variety of antibodies against blood cells, etc. But yes, essentially that is what they're looking for.
All right. And I don't see any more questions. So wait, hold on.
403.
If you sign up for the Meijer vaccination clinic, do you still have to live or work in St. Clair County?
So as far as Meijer goes, you have to be a customer of Meijer's pharmacy, and that's their requirement. I do know, like the health department put on the comments, Meijer is also using our list, which is really good news. But just know that you must be a patient with Meijer to use their facility.
Meijer's isn't using our list. Meijer's is using their own list. Sorry, it's confusing.
Sorry, I just read that.
Kroger's is using our list, but Meijer's is using their own list. So I would register with them and see what happens. Remember, and the only other thing I wanted to mention about can you go out of our county or whatever, remember that every county is receiving their allocations based on the population of that county. So if we had a whole bunch of people that showed up here to get vaccine here that didn't live here, it would basically take away our own residents' opportunities to vaccinate. And so do consider that in your, traveling around trying to get a vaccine somewhere else. Ideally, it's nice to stay where you live and work because that's how the vaccines are currently being distributed. But you don't have to. Yeah.
One person asked, can you display any, but they didn't finish their statement. So I'm not sure what they were trying to ask. So sorry about that. But other than that, I see thank you for doing your best in the time we were in. And someone else commented that you do not have to be a customer of Meijer. I believe that's what they meant.
That's good to know. They might have changed that. I know we had some secret shoppers go and sign up, and they were denied because they hadn't filled the script there. So they may have changed that. In fact, you know what? Now that I just mentioned that, I think I heard that on a state call that they got pushed back. This is a rolling, changing event.
Yeah,
And
very
like
fast.
Justin said, if you're gone for one day, you're just like out of it. Things are changing a lot. But if you do run into problems, things that just don't seem right, it's worth inquiring. It's worth sending us an email, because it's surprising how much we can get done sometimes by just like pushing a little bit and looking a little bit further into it. So
the other person did finish their question. Any truth in waiting for a mammogram after vaccination?
Oh, thank you for asking that mammogram question, because they asked last week and I was like, huh, what's a mammogram? So the vaccine is not going to have any impact on the radiology process of your the testing of your process. But what that mammogram thing's about is that a small percentage of people who have local arm tenderness will also get swollen lymph nodes under their armpits in the same arm they were vaccinated. And we were looking at the data. It's not a lot, I don't think. I think it's supposed to be like 2% or something. It's not even being talked about, but it's happening to people out there. And if you have swollen lymph nodes in your armpit and you go have a mammogram, number one, it's really uncomfortable, right? Because you know what you got to do with your mammogram. And the other thing is that mammogram is going to detect those lymph nodes, which is one of the things we look for that is like not good in a mammogram, right? So I think that's the issue. I would consult with your doctor that's ordering it and see if they do in fact want to wait for that. I don't know if they're routinely rescheduling that because they don't want to inadvertently be confused by that issue, or whether they're only going to reschedule if you have in fact the swollen lymph nodes. So good question, and I apologize for misspeaking last week, because apparently that is the issue.
Justin, you might be able to answer this. This person is age 70. They signed up on the pre-registration list the first day, and they still haven't heard a word. Is this unusual to be waiting this long? Do you want to talk about how many people signed up on the first day?
Sure. So no, it's not unusual. And like they put in the notes, we have not made it all the way through the first day of people signing up a couple of weeks ago because so many people did. I think the number was something like 5,000 or 6,000, correct?
Almost all of the people that we still have, right? We're still done on the first day. So, yeah.
Yeah. So, and what I was told the other day is we have roughly 7,300 people, plus or minus a couple hundred, to go on that list in that group, in the 65 and older group. And as you know, when we get 1,100 doses a week, that's going to take us a few more weeks to get through. But we're pushing every button we can to find options, whether it's get more vaccine in because it becomes available, or find out about regional clinics that are going to pop up here in the next couple of weeks, which you'll start hearing about.
Okay, the next question is there a charge for COVID testing in Marysville?
No.
No, there's no testing for the test. There's no charge for the test, and there's no charge for the vaccine.
The next question is, if I got my first shot in Marine City, will I get my second shot there too?
Yeah, we prefer that. We're trying to schedule things that way. It may not work out perfect that way, but that is certainly how we'd like it to occur.
All right. Well, I don't see any more questions. So if you guys want to do closing comments, we'll wrap up the show. It's 4:10.
Well, thank you again for joining us and asking good questions, keeping us on our toes, and keep up the good work. The rates are helpful to get these vaccines in people's arms while the disease isn't raging. But I'll say this over, and I feel like a broken record. I apologize, but don't let your guard down, guys. There's still people getting sick out there. And they're still spreading. We have the variant to worry about. So please continue to be careful. Stay in your pods. Try not to expose yourself to lots and lots of different households. Wear your mask. Stay home when you're sick. And please don't forget about testing. So if you feel like you're ill or you feel like you've been exposed, please come out and get a test. It does help us a lot.
And I'll kind of echo that. You know, obviously a big thank you goes out to our community partners, and just know that like I said a minute ago, we're doing everything we can to get as much vaccine in the county as possible, but it's a very scarce resource right now. And to follow with that, there may be some additional news, like I said, in the coming weeks regarding regional clinics, where we think a regional clinic may end up in the Detroit area, but it will accept patients from all over our region, all over the Metro Detroit region. So more to follow on that. And that will be federally supported, so it will not come out of any county's allotment. So that's all I have. I hope everybody has a great weekend, and we'll see you next Thursday, same time.
Thank you.
Bye.